here in Collingwood, Ontario, in Canada, which is right now, we're still under a lockdown due to COVID. I'm not sure where most people are. We've got someone here from Spain tonight, but whoever catches the recording too, that's where I physically am. And I, as a naturopathic doctor, I've been in practice for just about 10 years now. And this topic, menopause and perimenopause, I approached Lori about doing a workshop series, and it's such a big topic. The last topic we did, we started with sort of 101. So we talked a lot about the core symptoms and just like what is actually happening to your hormones at this phase of life. Today, we're going to get more into sleep, energy, and mood as it pertains to menopause and perimenopause. And these are big areas of concern that a lot of women will come to me. And once again, my passion for working with women when they're navigating what I'll call the midlife transition is I see too many women that are just feeling really not very well, not themselves. And they're overwhelmed by sort of, I don't know if there are any options. Can I feel any better? Is this just something I have to suffer through? And I don't want this stage of life to be synonymous with suffering. And I've come to see that there are a lot of things that can be done to help women feel better, optimize their health in the short term, and also in the long term as well. So we're going to talk more about sleep, energy, and mood today. And then I'll tell you what the third workshop is about too. But as I say, it's just such a big topic. It's hard to do it all justice in one go, and nobody wants to listen to me for that long. So I'm a member of the North American Menopause Society as well, which is a great resource if you ever just want to look that up, the North American Menopause Society. Doctors are members of that, but they have great resources for the public as well. Oh, hang on here. Okay. I apologize in advance. I don't think you'll be able to hear it because I have bees in, but my dog just came back with her dog walker, and she might bark a little bit, but she'll settle down. Okay. So I wanted to just put up here a couple things. These are things I've heard from women. And if you want to type into the chat right now, anything else that you've felt or heard yourself saying, maybe to a friend or, your doctor, whatever it is, what are you feeling at this time, right? You're like, I know something's changing in my body. And, as I say, like, there's things like, I just don't feel myself. I feel premenstrual most of the month. I can't remember the last time I slept well or woke up feeling rested, right? Like, unfortunately, I hear these things a lot. And as I say, I don't want women to settle for them. I do believe that, okay, we just have to start by having a conversation about it and determining, why is this happening and what are the options around making it better, right? So I just wanted to give a sense and sort of provide some context, right? Like, there are so many different complaints that women can have. And I'm not in this stage of life yet. So I can't personally say, like, I know what it feels like, but this is what I hear. And I've been hearing it for the last 10 years. So, once again, I'm familiar with sort of, okay, like, it's time to do something about this, right? There's concerns about memory that comes up, like irritability that feels really out of character, fatigue. Once again, we're focusing more on the effect that perimenopause and menopause can have on the brain today. So it can feel like, there's so many things like that just go wrong, and like, this sucks and it's terrible and like, ugh, to be a woman. But the other thing I just wanted to do was, this is a natural transition, and your body is going through a process that it's meant to. So just take a minute, and maybe if this helps you at some point, maybe not right now, but I liked these sort of visualizations or affirmations, if you will. So look down at your body. There's no home like you, right? Thank you. Remember that your body is here to help you, move through life and do all the things you want to. And sometimes it needs a nudge in the right direction, or it needs extra help putting in places the factors that help it heal. But, I believe that we do have everything we need inside of us. And as I say, sometimes we need help to get there, but let's also be grateful for our bodies and who we are as women and what makes us unique and fabulous that way. Just a quick reminder about the roller coaster hormone ride that we can go on. this shows you pictorially, like sort of what's going on with perimenopause and menopause. We dove into like the difference between these two stages. And I'll just remind you here again that perimenopause on average lasts 6 to 7 years, and it's like the lead up to menopause. And menopause technically is when you've had no period for a year, a full year, so 12 months. So perimenopause is everything before and actually a little bit after that last period. And you can see that there's more up and down in the hormone level in perimenopause, especially with estrogen, whereas once you're postmenopausal, it's just a consistent low state. So there are characteristically different symptoms for both of these stages. So perimenopause, just to remind you once again, newer, heavy or longer menstrual flow. So heavier bleeding can happen, shorter menstrual cycle length, or sometimes really stretched out cycles. So women say like, I haven't had a period in 4 months, and then all of a sudden I got one. That's classic perimenopause. Breast tissue changes or soreness, newer increased menstrual cramps, new mid-sleep waking, or even difficulty with sleep, I would say in general. Onset of night sweats or hot flashes, these can come and go. For some women, like hot flashes are just like a blip. Other women, they're like brutal for. It really varies. Any sort of like really, anything I would just say with perimenopause, anything that's new for you or feels a lot worse, it's worth talking to a healthcare provider about it for sure. So headaches, newer increased PMS symptoms, whether they're just like intensified, PMS is that window before your period, or you feel PMSy and you don't have a period and you're like, why do I feel like this, right? It's worth talking about that. The dreaded 5 to 10 pound weight gain that can happen from time to time, or with a lot of women for no explainable reason. Brain fog. I mean, it doesn't sound fun, right? But all of these are possibilities within perimenopause when the hormones start to fluctuate. Another graph here, like just to remind you, very early perimenopause will generally happen in the 40s, mid 40s, I would say on average, but sometimes way earlier for women. And then the menopause transition, usually there's going to be some irregular periods. And then the final menstruation is, once you've gone a year, then we say that you're menopausal. So you've really entered into the differences. Perimenopause is a bit more up and down with the hormones, whereas menopause is now it's a consistent low hormone state. And once again, the core symptoms of menopause, vasomotor symptoms, so hot flashes and night sweats, which can really tie into sleep troubles, because if you're waking up sweaty and hot, throwing the covers off, raise your hand or say like, oh yeah, this has happened. They can be really disruptive to sleep, and a core way that sleep is affected for women in perimenopause and menopause. Low mood, depression. I will say with mood related concerns and this transition, any woman who has had an experience of a depressive episode or anxiety, or one of those conditions before, is probably at a higher risk when they go through the hormonal transition for it to be exacerbated or worsened. So it's always worth bringing that up with your healthcare provider. There's a variety of ways to help support that. So just something to know. Once again, brain fog and cognitive challenges are just like feeling foggy, having issues with like short-term memory, remembering names, right? Even word retrieval can feel a bit slow. And I've had women say like, do I have Alzheimer's? Should I be worried? Like it can be that much. They're like, this is really unusual. And while it's always like worthwhile, figuring out like, is it something we should be more worried about? Usually it is related to just the brain is literally being affected by the drop in hormones that is happening. Genitourinary syndrome in menopause, we talked about that. That's like vaginal dryness, urinary tract symptoms, those kinds of things, the midsection weight gain, joint pain, stiffness, bone loss, which usually you can't feel so much, but we can pick it up on bone density scanning, and skin changes, hair loss. Female pattern means it's like from the top of the head generally. Okay, let's talk about your brain on hormones. So once again, I mentioned like mood issues can be exacerbated when you go through perimenopause and menopause. And that's because your brain is very strongly influenced by estrogen and progesterone, amongst a number of other things, but we'll just focus on those for the time being. So the female brain with these hormones, when we ideally are having a normal menstrual cycle every month with the normal high and low of estrogen and progesterone, our brain literally changes in our menstrual cycle, right? So if you didn't know this too, like women around ovulation, we're sort of at our best from a performance point of view. We're going to feel more confident. We're going to be in a better place to make presentations or, actively take on new projects. And then when we're premenstrual, if you're sort of going with the flow, your hormones are dropping there. So it is a time of sort of being a bit quieter, being a bit, maybe not as outgoing. You don't feel that way. Like that's totally natural. So once again, when you go from a place where your hormones, let's say they were here and now they're here, your brain is going to feel that, right? Estrogen supports serotonin in our brain, which is a happy regulating hormone when it comes to mood and also mitigating anxiety. Estrogen supports the architecture of our sleep, our ability to get into deep sleep and rapid eye movement. Estrogen also supports like memory and cognitive function. There's literally like the great female traits that make us women a lot of them are accounted for by estrogen and how our brain works on estrogen. Like we are different than men in that way, right? We're not just little men, we are women. And that's because our hormones are different and they affect our brain and our body differently. And then progesterone, which is, if you remember, estrogen's like the building, stimulating hormone, right? Progesterone's like the calmer, cooler little sister. Progesterone has a really unique calming steroid effect in the brain. So it'll come up again how progesterone can help quite a bit with sleep when it's dipping in perimenopause and menopause, but it's quite a calming hormone in general. And so I just want to share with you a little bit, like this is your brain on these hormones, right? It does a lot for us in that sense. Okay, so there was just a quick question here. My last period was in December and I just started again today, so 5 months ago. Is this typical? Yeah, it can be typical. You can go through a period where it's like for a while, like who knows, like you won't know when you're going to get your period. And I don't know about symptoms that you had that maybe told you it was coming, right? Or you were like, I haven't had my period though. What's going on? That's pretty typical. What's not typical is if you go 12 months without a period, and then you have a bleed again or a period, you need to see your doctor for that because we need to do an ultrasound to make sure that there's not something else going on. But 5 months ago, that's pretty typical. Okay, Sleeping Beauties. This is one of my favorite movies. We're going to start with talking about sleep because I do feel that sleep impacts so strongly. The quality of sleep can so snowball into affecting your mood and your energy. You might be like, yeah, that's obvious. It is, right? Like it affects all these things. And I find often when I work with patients, if I can help them sleep better, a lot of other things get better on their own, whether it's mood, memory, overall feeling of well-being, energy, once again. So let's talk about sleep first. And I don't know if anybody sleeps with as fancy a mask as this, but love those earplugs too. Hot tip though, if you do have animals in your room, maybe not a good idea. Myself included, I have a dog that tends to sleep on the bed and I know it's not a great idea. I don't imagine I could sleep through a cat being on my back like that. Okay, this pictorial here is from a research study all about sleep through women's lifespan. The reference is right there. If you search like Pango 2018, it would pop up. It's a research article, but it's more of a review. Like if you just wanted to read more about sleep as a woman, it's a great article that summarizes everything from childhood to puberty. I just wanted to point out once again, you're looking at things like rapid eye movement. WASO means wake after sleep onset. So you can see the pink bar gets wider at perimenopause, right? And even after. So that means we know women wake up more after they go to sleep through this transition and they get less rapid eye movement. Rapid eye movement happens in the early hours of the morning. It's sort of like the later stages of sleep. It is actually really important to memory consolidation. So there's probably an impact when you're not sleeping well on that piece there. Interesting thing about naps, they go up in pregnancy, but focus on the perimenopause, really that wake after sleep onset is what I think is significant here, which is a common concern. Okay, so sleep challenges, they're common. They're considered a core symptom of perimenopause and menopause. They affect 40 to 60% of women at some point. The National Institutes of Health cited sleep disturbances as that core symptom. They are, unfortunately, chronic insomnia can develop in up to 42% of women by the end of menopause. So women, sometimes it's not long lasting and it's just, it just happens for a time, and for other women, it can become more persistent. There is an increased likelihood of sleeping challenges linked to the severity of vasomotor symptoms. So night sweats are basically the word we give to hot flashes when they happen at night. They're really disruptive to sleep. I have them occasionally when I'm premenstrual, when my hormones are bottoming out, and I would say mine are mild. So I can only imagine what having a real doozy one of these would do to your sleep. Women who go, any woman who experiences medically induced menopause, so whether they've had surgery like a hysterectomy, a partial hysterectomy, or maybe they've had cancer treatment, which can affect the ovaries. There can be other drug-induced menopause. Women that go through that kind of menopause, which is not entirely natural in a sense, they tend to have worse sleep. And these women also tend to just have worse symptoms of menopause. So hot flashes, mood disruption, aches and pains, like all of it. So I'm a big believer that women that experience medically induced menopause need a lot of support to help them feel their best. So let's define insomnia just technically quickly. It's a dissatisfaction with the sleep pattern. So either getting to sleep, initiating sleep, or staying asleep. Technically speaking, and I don't really care, I just listen to this, but technically speaking, it means that you have this for at least 3 nights a week for more than 3 months. And then technically that would be a conventional diagnosis of insomnia. And there also needs to be, like, it interferes with your daily functioning, right? So that's like, I'm just too tired to do what I typically would do, right? That kind of thing. Typically insomnia is not often primary, meaning like we don't know what's causing it, right? It's very often, as you can see here, up to 77% of insomnia related sleep complaints are secondary to something. So secondary to hot flashes, secondary to sleep apnea, which I'm going to go over a bit more, maybe hypothyroidism, anemia, bladder issues. So like, are you all of a sudden waking up to pee 6 times, right? Then it's secondary to that. Is there any pain? Then it's secondary to that. So whenever we're looking at a sleep issue, I always have to ask questions like, what else is going on that gives me clues as to why this might be happening? And then we build a plan from there. The other big factor can be psychosocial stress. So worry, any grief or bereavement. I mean, you could argue that COVID in and of itself is a factor these days. Depression, anxiety, these can all contribute to sleep disruption. If you're taking certain medications, so SSRIs are used to treat depression and anxiety, but they can cause sleep side effects. Steroid medications used if you have autoimmune condition or something like that can affect sleep. Beta blockers, which are used for blood pressure, can negatively affect sleep. So I'm just making the point that there's all kinds of things that we should consider, right? Alcohol and caffeine, unfortunately, no amount of either of those help with sleep. You basically want to stick with caffeine early in the day, far away from bedtime. And I'm not going to beat around the bush. Like, there's no amount of alcohol that helps with sleep. You might say, Bronwyn, though, it helps me get to sleep. Maybe, but it never helps with the quality of your sleep later on. We'll come back to that. And then habits around sleep. So that matters too, for sure. And when I say hygiene, I mean habits. I mean, like, do you go to bedtime regularly? Like, what else are you doing around bedtime? All those kinds of things. We'll come back to that. So sleep apnea is, there's obstructive sleep apnea, which is caused by obstruction in the airway when you sleep. And then there's a form called non-obstructive, which is rarer, and it's caused more by the nervous system not coordinating properly when you sleep, which sounds pretty scary. This is a questionnaire that I often will go over with patients if I have any reason to suspect sleep apnea. Because once again, if it's going on, it needs to be addressed, because it will not help with sleep if it is not addressed. Gaining weight quickly can be a risk factor. Women premenopausally are at a lower risk than men for sleep apnea. But when women go through menopause, their risk goes up for developing sleep apnea. So this questionnaire shows you things like, do you snore loudly at night, right? Do other people tell you that you snore loudly? Do you often feel tired or sleepy during the day? Has anyone observed you stop breathing during your sleep? Are you being treated for high blood pressure? And then there's questions about age, neck circumference, things like that. So the scoring system can help me be like, ooh, like I can't order sleep studies, but in a scenario, if this was really high, I would refer back to have someone have a sleep study done. And I've seen women where this has been diagnosed around menopause, and it does really help them when it's figured out, and then they get on a CPAP machine. It helps them feel a lot better. So once again, with sleep, we always want to consider the big picture. Yes, the hormone changes are a factor, but there are other things going on too that we should consider. And you know, when you're menopausal, you're not exempt from these basics as well. So how are daytime and evening routines helping or hindering sleep? Routine is really important. Our brain likes routine, and our brain to sleep, it really likes routine. So, and that's bedtime routine. So going to bed, you know, an hour later one night and then an hour earlier, like over time, that can be a problem. Wake up time matters too. So regularity as far as when you wake up and when you go to bed matters. We all have something called a sleep drive inside of us, that from the moment we wake up, we're building up this sleep drive, or think of it like a bubble that we blow up as we go through the day. And we want to hit like maximal sleep pressure pretty close to bedtime, right? When we feel that maximal sleep pressure, if you can imagine, you feel tired, you feel like it's sleeping time, you should go to bed and listen to that, right? But sometimes with lack of routine or regularity, it's difficult to build that drive up quite the same. And sometimes we just don't listen to it as well. So routine is really important. And I really try to think of it like I have a morning routine where I like get out in the daylight pretty quick. I walk my dog pretty quick. I have a big glass of water. I do have a coffee. That's my routine, but that routine is helpful for me, right? And then on the flip side, I have a bedtime routine. We'll come back to that. Sleep runway, I call this like, this is like your lead into sleep, right? You got to consider that like your brain can't go from like doing and being alert and all the things to just going to sleep, right? This might be the classic scenario where like you're tired, but you get into bed and your brain is like, you got a monkey brain, or you feel like it's just running away. You have to prepare your brain for sleep. And sometimes when we're not sleeping well, it's even more important to do this, to give ourselves a bit of a runway into sleep. So there's so many options that can build a sleep runway for people. You got to do what works for you, right? If something on this list is like, you know, that's like not my thing, don't worry about it. Try something else. I have a bath almost every night, which makes me feel very sleepy. Bath encourages a rise in temperature, but then a drop in temperature, which actually makes you even sleepier and encourages melatonin release. So that's part of my routine. But you just have to be, it just has to be quieter, and ideally not using electronics right in front of your face. That is stimulating and it fights with melatonin secretion in your brain. So that doesn't help with sleep. But think about what are you doing in the hour, at minimum half hour before you're trying to go to sleep, right? Exposure to light, I mentioned I get outside pretty quick in the morning. That tells your body clockwise it's daytime, right? If you respond to the light cues and then you go to sleep when it's dark, that helps. Now, shift workers need a bit of extra help here. I don't know if there's any shift workers here, but there are reasons that sometimes we just can't follow that. Movement, and you know, I hesitated to call it exercise, but just movement, and a bonus if it's outside, builds up that natural sleep drive, which helps us get to sleep and stay asleep. I mentioned the caffeine. Keep it away. Like my ideal is not within 12 hours of bedtime. So if your bedtime is 10:30, you have to be finished drinking coffee by 10:30 in the morning. And I know sometimes we're using coffee in the afternoon to perk us up or make us feel a little bit better. It's not going to help with sleep at that point. We want to assume that it's going to take you 12 hours to fully clear that caffeine from your system. And then I mentioned alcohol, minimal to zero. The lower, the better for sleep, unfortunately. It might make you feel like it's helping you get to sleep because it just helps. I know it can help you decompress and, sort of unwind, but it does not ever help with the quality and depth of your sleep. And furthermore, it can worsen hot flashes at night. Think about what is literally keeping you up at night. Is there literally something that you're stewing over at night, right? How can we help with that? Make it like a cave, dark, cool, and quiet. Bedroom is for sleep, sex, and sickness only. Ideally, you're not doing work in your bedroom or like in your bed at least. The bedroom should be like hopefully a calm, this is where I sleep, right? Other things don't happen in here. Your brain makes a very quick relationship between what you do and where you sleep and how that goes. I often suggest, and I try to do this myself, especially on the front of like, what is literally keeping you up at night? All the things that like irk us in a day or our stressors, sometimes it's just a matter of like, we're not processing them early enough. And then the first opportunity we have to do it is when we get into bed, when things are still and quiet and whatnot. So can you do a little bit of a mind dump or at least acknowledge some of those things earlier in the day? Just try to like imagine symbolically, like you're getting them out earlier instead of you go to bed and now my brain wants to remind me of all these things that happened in my day, right? Ditching your phone, scrolling and, being on the phone. It just, unfortunately, I just don't think it ever really helps. So trying to build a routine away from that is really, really helpful. Get a sleep study if it's indicated. Once again, any symptoms suggestive of sleep apnea can help determine if that's needed. Eating for balanced blood sugar. This is another tip. Sometimes, especially if women wake up between 2 to 4 a.m., you might feel hungry or not, but that can be that your blood sugar has really dropped and your stress hormone cortisol has come out to respond to that, which is normal, but it wakes you up and it can make you feel quite alert. So if you feel, and a reasonable experiment to do would be to take a small pre-bedtime snack of something with a decent amount of protein in it to keep your blood sugar balanced. So almonds or pumpkin seeds. To be honest, I keep a little container of them in my bedside table, and I do tend to have a little bit of a handful, just a handful before I go to bed. You don't need to eat a lot. You just need a little bit. That can help stabilize your blood sugar. And then estrogen, progesterone, that's going to come on the next slide. But there is a place for hormone replacement therapy with regards to improving sleep for women at this time of life. And I mentioned once again, like progesterone is very calming. So if women are just distinctly quite anxious, and that progesterone is going to help, it often will, right? And estrogen too plays a role in sleep and building sleep architecture. So it's what I'm kind of saying is like your brain, when these hormones fluctuate and change on us, it's almost kind of like, seems like, well, if we know that, then it's like our brain is going to be different, right? It literally is going to be different. It just takes time to adjust. But once again, that doesn't mean that there aren't options around helping it sooner. So estrogen improves the quality of sleep as well by decreasing vasomotor symptoms. So if you're having brutal hot flashes and night sweats, this is where hormone replacement therapy can certainly help. And if those are better, then often sleep is better. It's not always that vasomotor symptoms are causing sleep disruption, but it's not uncommon. Oral progesterone, as I mentioned, oral, so you have to swallow it. You can't apply it on the skin like a cream. It probably won't help with sleep that way. As you can see, it actually has a sedative-like effect through increasing something called GABA, which is a very calming neurotransmitter. And this is for this reason, we only give oral progesterone. You always take it at night because it would make you too tired if you took it during the day. Once again, HRT or hormone replacement therapy theoretically can improve sleep quality by reducing nighttime awakening, whether it's hot flashes or not, to be honest. In the research, it's just like this general concept that women wake up more. Perimenopause and menopause, HRT does seem to help. So I've mentioned progesterone. It can be used on its own. Sometimes we can use progesterone on its own. Whenever we give estrogen, we have to give progesterone with it. progesterone protects the uterine lining from being overstimulated by the use of estrogen. So once again, we can give progesterone on its own without estrogen, and it can be a reasonable place to start for a lot of women because it can help with sleep. But estrogen needs progesterone to be given with it. So there's different options, and often I look at the totality of a woman's symptoms around using these kinds of hormones, right? So if there's also hot flashes and vaginal dryness, and we know she's at risk for bone loss, then I would consider big picture the best way to go. Yeah, but I just wanted to mention that. Other options that are not hormones, ladies, there are other options. Melatonin, maybe you've heard of it. A lot of women come to me saying, oh, I've tried melatonin. It didn't really work. It is, I put question mark because I do find it hit or miss as far as how well it works. For some women, it works great. Melatonin is a natural hormone that we produce deep in the center of our brain, and it's the hormone that should come up to help us go to sleep. It's the opposite of our daytime predominant alerting hormone, which is cortisol. So melatonin, you can take it supplementally. It's interesting, the research around melatonin for sleep and insomnia is actually not, it's very mixed. Like a lot of research says melatonin didn't seem to help. It does help people that do shift work, and it does help with jet lag when you move from time zone to time zone. But for otherwise sort of like in secondary insomnia, it often doesn't work. So, I mean, this is where like, it's not uncommon that women have already tried it when they come to see me. Sometimes if they haven't, I sometimes will dose it on my own. It just depends on the case. With melatonin, dose matters. Sometimes you might not be taking a high enough dose. Sometimes it is too much. Side effects would be that you feel kind of groggy and a bit hungover after more melatonin. So, but it's worth mentioning for sure, because it is a common one that women are often like, oh, I was told I should just take melatonin. There are lots of herbs. I've made a list here. With anything on this list, always talk, it's ideal to talk to a doc about starting anything like this, because there's always possible interactions to consider, allergies, things like that, right? But there's lots of herbs that help with sleep. Tea, tincture, there's all kinds of forms to take it. Cortisol regulators are herbs that help your body adapt to stress in such a way that, you know, sleep can be thrown off by the stress load during the day, and that it builds, right? So there are herbs that are really great at helping regulate the way we secrete stress hormones and how we actually respond to them in our body. And these are not, it's really common that I'll employ these for women going through menopause, because I think in and of itself, the hormone drop is a stressor in and of itself. So women are often coming to me where they're a bit sandwiched, like in their life, there's a lot going on. They're taking care of aging parents. They've got teenagers at home. They've had a job change, or they're still working. And then they go through this big change. And I'm like, yeah, like no doubt, right? They just need more support on this front. There's things like GABA, which you build in your own brain, but can be taken supplementally, amino acids like theanine. I'm just making you aware that there are all kinds of options. When I sit with a woman, I try to listen and learn from her to determine what's going to work the best. 5-HTP is another one that can be helpful. It's taken supplementally. Do not combine that one with antidepressants. Ideally, always talk to a doc about these things first. Magnesium, I wanted to definitely share with you. Magnesium's a mineral, and we get it from foods that we eat, but taking magnesium supplementally is a real favorite of mine for sleep support. It doesn't work overnight, meaning you can't just take it once and be like, oh yeah, it was magic. It works so great. I think it works best when you take it with a bit of consistency. I recommend bisglycinate or citrate form for sleep, and it can be really helpful. So you can email me with questions about that. Ideally, once again, anything here would be worked on prescribing with a doc. And then there are prescription sleeping aids. And listen, when they're needed from time to time, it's fine, right? Like ideally, most women come to me if they've been needing to take a prescription medication for months to help them with sleep. They're coming to me because they want to take something different, but still they have their place from time to time, and absolutely no judgment around that. This is to show you here, this is your cortisol. So this is the hormone that wakes you up and makes you alert and helps you do all the things that you want to do in a day. So you can see it really comes up in the morning, right? And it peaks, pretty much like mid-morning, 9 to 10, and then it decelerates for the rest of the day. So you are like, your body's like really heightened and awake at that time, ideally, and then it falls off as the day goes on. You can see it should stay nice and low as we head into the evening towards bedtime, nice and low at its lowest level in the, between 9 to 12 a.m. And then it starts to come back up, right? It's going to wake us up eventually. So when I'm listening to women talk about sleep and their energy patterns, often I can hear that something with this cortisol secretion, this is the perfect ideal scenario. Now, if we've been under stress for a long period of time, or we've had any other illnesses, a number of factors can make this look different and mean that your cortisol is not coming up like that, and mean that it's coming up, it's staying too high at night. All kinds of things can be going on. So this is the ideal. This is melatonin. So like it's the opposite of cortisol. Cortisol comes up in the morning and then is low. Melatonin on the flip side comes up in the middle of the night, right? You can see just after midnight on this graph, and then it falls as the morning goes on instead of picking up like cortisol does. Now, this is a picture of testing. We can test cortisol and map it out in a day. This shows you here. This is someone that I imagine their cortisol is the red line at the top here. It says patient values, and the bottom, the high range limit is the black line below it. So their cortisol is really high. And I imagine that they feel a little bit keyed up, maybe a bit anxious, and they might have troubles with sleep in this scenario. So cortisol is like Goldilocks, like all hormones. You don't want too much and you don't want too little, and not over a sustained period. So it can be too high, which doesn't help with sleep, or it can be too low. And this is a pretty tired out sort of pattern where you can see the red line. It's actually even hard to see it because it's right clinging to the low range of the cortisol there. And even this low, like low makes you feel tired and your brain will feel pretty foggy and everything can feel a bit slow. But even when it's low like this all the time, it doesn't help with sleep either, because you need that cycle of cortisol to come up in the morning and then fall. And if it's just like this all the time, like a flat line, it doesn't help. So we need to help in either scenario. So cortisol, the stress hormone, it's kind of like cortisol is always there. We need it, right? It's a normal part of our daily response. But if there's dysregulation there or something funky going on with our stress hormones, it's like throwing a bit of gas on the fire when we're going through a drop in estrogen and progesterone and changes there. So cumulative stress is the real problem, right? We have a body that's built to respond to stressors, but it's the wear and tear and the unrelenting stress and our ability, how do we manage that is a problem. Cortisol tends to get in the way of our progesterone, estrogen, testosterone production, and you still make a little when you go through menopause. You still make a little, but if you're super stressed out and your adrenals look like that, you're not going to make much of it at all. It disrupts sleep patterns. I mentioned that. It tends to get in the way of blood sugar regulation and causes something called insulin resistance, which means you're going to pack on weight in your midsection. Cortisol loves to do that. It will slow our thyroid down, which sits on our neck. Our thyroid's very sensitive to stress hormone dysregulation, and it can impair short-term memory and cause brain fog. So we always have to think about these stress hormones and how they could be playing a role. Okay, I'm just checking this chat again here. Okay, so stress hormones. Yeah, a little bit of gas on the fire. I'm just checking my time here. Okay, groovy. Okay, I put up this picture here. I think I've mentioned alcohol before, and I might not be making any fans, but I never want to beat around the bush around this. There's no amount of alcohol from what I've read and my belief that is really doing us any benefit, especially on a sleep front, for sure on a sleep front, okay? So I think reevaluating one's relationship with alcohol and why we use it, we need to be cognizant of that. And then coffee, same thing too, right? Coffee as well. Like we often, when we feel worse, we need to drink more alcohol and more coffee, right? These things will sort of prop us up in a sense, but they're not really building any foundational aspects of health, right? I know that they are pleasurable. I just think they need to be really treated and used in moderation. And I mentioned the rule about caffeine, so 12 hours away from bedtime, okay? So low energy, I mean, we've talked about sleep now. I mentioned like there are all kinds of non-hormonal options. There's room to consider hormonal treatment. We want to think about the stress hormones, the routine around sleep. All these things matter. And, you know, once again, I've mentioned if sleep gets better, often I find energy response, but there are lots of causes for low energy, right? So it's really important to work with the doc to figure this out. And this is where my hope is not that doctors, that it gets sort of checked off as like, well, you're just tired because of your age, right? Or it happens to like women too when they're pregnant. Oh, you're just tired because you're just a mom. You're just tired, right? Like I'm always someone that's there to listen and dig a little deeper, right? Yeah, maybe sometimes it is just life, but maybe sometimes it's more. So once again, is it sleep? Is it hot flashes bothering your sleep? Is it a mood related change? Depression or anxiety can just make you more tired. Is it chronic stress related? Do you have anemia? Are you lacking nutrients? Are you bleeding? Are your periods super heavy? That will cause anemia in women that makes them super tired. That needs to be addressed. I've seen that tons. You can have anemia for other reasons, like if you have liver disease or kidney disease or something like that. So we always need to consider it, but it needs to be looked into. Nutritional deficiencies, so iron, once again, which is usually low iron in women, is usually a result of blood loss due to periods. Not uncommon that the periods get heavier or wonky as part of this transition, so puts pressure on that. And women are often maybe a little bit borderline anemic heading into it, and then they bleed a whole bunch more and it's not making it any better. And yes, there are iron supplements that don't constipate you and make you feel terrible. It just matters what they are. Vitamin B12, I routinely check. Vitamin D, I routinely check to look into energy and fatigue related concerns. We always want to consider like protein, fats, carbs, like basics of diet. Once again, blood sugar regulation. So highs and lows of blood sugar can really contribute to your energy consistency. If you're riding a roller coaster blood sugar wise, you'll feel like, okay, I feel good. And then I crash out. And then I need to eat again and I feel good. And then I crash out again. So it's just a bit of like up and down. Hypothyroidism, the thyroid, when it slows down, its thyroid hormone production will just generally make you feel, it kind of makes you feel like everything's like slow motion, kind of like you're moving underwater, like you feel tired, your body feels tired, your brain feels tired. It's like a sluggishness, and that we need blood work to figure that out typically. On the stress front, we all have stress. We all have varying amounts of stress. It's not realistic to be rid of it, but we do have to get real about how much we put on our plates, what we say yes to, and what we say no to. And I myself, it's hard to say no, right? But how can maybe we need to reframe expectations of ourselves at this time, or when we're not sleeping well, of others. Like, I'm not saying this stuff is easy, but I just think it's worth mentioning for sure. We have to get real about how we're managing stress in our lives. I'm a big believer in practicing self-compassion, even though I don't always do it very well. This is basically the idea of like, what would you say to your friend, right? Or a loved one if they were expressing, you know, a challenge or a feeling, right? You need to say the same thing to yourself, which is easier said than done. Gratitudes and mindfulness. I write in a 5-minute journal every day. I start my day with a exercise and like thinking about like what I'm grateful for. And I do the same thing before I go to bed. Honestly, it takes 3 to 5 minutes. And once you get into a habit around it, it can really help. It really helps with mindset and is a great way to manage when, you know, things feel a bit heavy and dark and, you know, will the lockdown ever end? This kind of thing. Asking for help. I know that can be hard, but it's the first step for sure. Women have a unique ability to reach out to others, and it's more of a female trait to tend and befriend in times of stress. You might have heard of fight or flight. Tending and befriending is another core response to stress that women uniquely have. So use it. Move, rest, sleep, nourish your body. Those are like basics, right? And think about what is in your life that really feels like it fills your cup. And filling your cup, I mean, that's like what fills you up, right? Like just what gives you joy, pleasure, feels, nourishing, replenishing, all these kinds of things. Ideally, we have little bits of that every day. For me right now, it's gardening. I'm a real gardening geek, but it can be, it doesn't matter what it is. It just has to feel good to you. Eating for stable blood sugar. So I wanted to mention this again for energy, because just riding that roller coaster doesn't make you feel any better. Protein is huge. I find a lot of women are not getting enough protein. You need 1 to 1.2 grams per kilo of your body weight to meet your body's needs, to make sure that you don't pull from your muscle over time. And remember, we're always fighting a battle against muscle loss as we age too. So protein's really important for that. And believe me, it does not help you feel more energetic, more brain-wise any better to have low protein. So for an example of the calculation here is you need 70 grams minimum if you weigh 150 pounds based on that calculation. Like for me, I need closer to 90 grams a day. And you might be like, well, that's a lot of protein. You split it up as the day goes. So I eat 3 meals a day, usually plus 1 snack, and I try to split it up. And I help patients sort of, really work out what this looks like. Sometimes women want to track this. So they'll use something like MyFitnessPal to track temporarily, like, what am I actually getting? And it helps you understand, like, okay, I'm falling like 30 grams short of my target. And this is what I would need to add to get there, right? So protein is essential. You need lots of good protein to keep blood sugar stable. You also need good amount of fiber, and you need fat. Those are the key ingredients. And carbs, like, I'm not saying don't eat carbs, but when you eat carbs, if you ate carbs like white bread, white rice, white pasta, sugary food with no protein, fiber, or fat, that's where you go up really quick and then you crash really quick. So the protein, fiber, and fat are what slow sugar release down and keep it more steady. Okay. So blood sugar balance, really important. Eating for overall hormonal health. I mean, the basics to me are like, you need good nutrition to just really fuel your body with the backbones that build hormones, build neurotransmitters, which are things like serotonin, GABA, dopamine, the things that keep us feeling well up in our brain. I mentioned the protein. Fat intake as well needs to be considered. Your brain is full of fat. And it needs good fat to function properly. And you need a reasonable amount of calories from your diet to be from fat, ideally. Now, the ideal fat is ideally plant-based fat. So extra virgin olive oil, avocado oil, coconut oil, flax seeds, chia seeds, any kind of nut and seed, fish and fish oil supplements. Sometimes I will prescribe. Full fat dairy. I mean, having some amount of meat, I would say maybe once, max twice per week, where there's fat in the meat is reasonable, but that kind of fat is it's a highly saturated fat, so it's a bit less heart healthy that way. You want to focus on plants for this kind of thing. I mentioned calcium. Calcium is actually really important to treating PMS symptoms. So if you are a woman that's still cycling and you have PMS, consider calcium through your food or in a supplemental form. Calcium helps regulate the brain when the hormones drop. It has a lot to do with that. You might be like, oh, it's just for bones, right? No, it's a lot to do with your brain too. So think about calcium-rich foods. It doesn't have to just be dairy. Fish can be a good source. Different nuts and seeds like sesame seeds are a really good source. Chia seeds, different veggies like beet greens, spinach, broccoli, like all good sources of calcium. I've mentioned fiber. I feel like fiber is one of these things that we talk about it. We all know that we should be eating lots of fiber. Sometimes it's just, once again, like, it's easier said than done. And you have to put some intention into being aware of, like, okay, where am I getting my fiber from? How am I doing on that front? Not only does it help with bowel elimination of toxins, hormones you don't want, it also really helps regulate blood sugar as well. Some superfoods that I often talk about a lot for women at their hormonal transition. Broccoli sprouts are full of a compound called sulforaphane, which is a really powerful antioxidant in the breast tissue and in the brain. Brown flax seeds are a source of phytoestrogens, and I'll come back to that. Phytoestrogens are not bad or dangerous. They're actually really good for you when your hormones are changing. And they're a really good source of that. Whey protein is just an easy way to add like 20 grams of protein to your diet. It's just easy, I find. A lot of women do well with that. Organic soy, once again, phytoestrogen, also very high in protein. Blueberries are on this list too, because even a half a cup of blueberries, I think, has been shown to improve blood sugar balance and energy in research. So this is a picture of like, these are the bulk of the foods that you want to make up your diet. I mean, there's lots of plants, there's lots of vegetables, there's fish, right? Eating more protein from things like beans and fish is better than eating a sort of meat and potatoes kind of diet, for sure, for overall blood sugar, diabetic risk, heart health, overall cognitive health. There's just, there's lots of color. There's lots of natural foods. It's not fancy, but this should be the mainstay of what we eat in a day, ideally. And there's variances to all this. And then so phytoestrogens. So I'm showing you here pictures of phytoestrogens. Any kind of beans, lentils, flax seeds are there, soy, nuts, soy milk, chia seeds, they all contain phytoestrogens. Phytoestrogens means plant estrogen. It's not the same as the estrogen in our body. It looks different, but it is a compound that is still capable of binding at our estrogen receptors, which means phytoestrogens can stabilize symptoms of low estrogen, hot flashes, night sweats. I find those in particular what women will notice can get better with phytoestrogens. But research has shown that phytoestrogen consumption improves bone health in women. It improves cardiovascular health. It improves muscle mass. So the research does not suggest increased cancer risk if you've been told otherwise. It was just assumed phytoestrogens are estrogens and estrogens are bad for breast cancer risk. It's not the case. Phytoestrogens, if anything, most recent research has shown that if anything, they're protective because they bind at our receptors and keep the stronger, I don't want to call it badder, but stronger estrogen off the receptors from stimulating. So don't be afraid of phytoestrogens. That would be my advice. Okay, HRT and brain health. So hormone replacement therapy and our cognitive health. It is indicated, hormone replacement therapy, so estrogen and progesterone I'm referring to in this scenario. Progesterone can be considered for a sleep supportive effect, but if there's other, I would say like distinct low mood issues with mental clarity, we probably want to consider both estrogen and progesterone. So it is indicated and a well-researched treatment option for the mood changes associated with perimenopause and menopause, both perimenopause and menopause. That can be mild to moderate depression or anxiety. And it has been studied for the cognitive symptoms, so issues with short-term memory, brain fog, these kinds of things. Hormone replacement therapy is also indicated as part of a strategy for premenstrual symptoms. So PMS is that classic, window before the period. That often feels wider in perimenopause. So I'm speaking to anyone with perimenopause here, or when you catch this on the recording. If you feel like PMS is getting worse or wider or longer, hormone replacement therapy can be considered as an option. There are lots of other things, as I mentioned. Calcium you might want to think about. There are other herbs, but I just wanted to mention it can be part of a strategy for worsened PMS symptoms that are affecting, mood and your function at that time. In the short term, hormone replacement therapy does seem to improve the quality of life measures in relation to sleep and mood. So it improves quality of life scores for women. There is a bit of mixed data around hormone replacement therapy and dementia and Alzheimer's risk. It seems to be most protective if it's used right around the menopausal transition. So for example, a woman does go through menopause, her last period's at 52, and then she comes at 65 and wants to explore HRT. The research is more mixed, and there's actually a bit of research that says it might increase risk. So the best time to catch, and I would argue that it's always the best time to use HRT closer to the menopausal transition if you can. And that's, once again, there's just mixed research around the risk when we're farther away from the transition and we initiate it then. Getting a baseline. So I'm a big believer in this. I do this routinely with my patients. I mean, we've talked about sleep, energy, mood concerns. I think often there's an opportunity when your body's going through the change that is and you're feeling different, like let's get a baseline for your health, right? it helps me not only understand like why might you be having some of the symptoms you're having, and aside from the obvious of like if I know that you're perimenopausal, or I know there's classic symptoms of the transition, fine, I might not test for that, but I might test for your B12 and your thyroid and your iron to make sure that that's okay. So I'm a big believer in that. I'm also a big believer in encouraging women to keep track themselves. Remember, if you're cycling still, track. There's lots of apps on phones you can track using good old pen and paper. That helps you take it to a doctor and be like, I'm tracking every month that this is happening, right? Or maybe it's not every month, but at least you're tracking it. And even women, when you don't have a regular period anymore, you can still track. And that still helps you bring to a healthcare provider more accurately what you're having. I just find as women, like it's harder to sometimes think back and be like with clarity, like this is what's going on. And sometimes as a doctor, I'm like, the more clearly I know what's going on, the faster I can help make the best recommendation for you. So tracking, don't forget about tracking. This is a tracker that I often give to women. Perimenopause and menopause will give it to you. It technically says menopause, but you can see this is just a rating score for a lot of the core symptoms. So there's hot flashes, sleep problems, mood changes, anxiety. I often give this, and I use this as a tracking tool. So I get it at baseline. So woman starts with me, she fills this out. 3 months later, she fills it out again. Another 3 months, she fills it out again. A year, she fills it out. So I'm looking to see, like, in addition to what she's telling me, I want to read this and know that we're going in the right direction. This is available online. I can email it if you email me and you want a copy of this. It's not special to me. It was designed by research-driven group, and I use it regularly. I mentioned this in the first talk, but really there is no test to diagnose perimenopause. The hormone levels are just too volatile. So when you're having erratic periods, and we're like, well, you're getting close, but you're not there yet, there isn't always a need to test. We can assume what's going on. And technically, you don't have to test to confirm that you're menopausal. If you've gone a year without a period, we can test something called FSH there, which if it's over 30 microliters, then it's confirmatory of menopause, but it doesn't have to be done. Sometimes running serum hormones can also confirm the likelihood of menopause. They'll be low, right? But they're not always necessary. I will say from my point of view, I often generally use blood work that includes hormones to help give me a baseline. And that guides my treatment plan. And if that treatment plan involves hormone replacement prescribing, I like to have the baseline and then a comparable, because I do know what sort of targets I'm going for. It's not sort of a flying blind approach where, well, I'll just give you hormones because I know they're helpful, but I have absolutely no idea what's falling out in your body. So I do like to use testing personally to give me comparables. And I find women like that too, because they feel like they know someone's checking in on it, right? Other tests. So this is like from a sleep, energy, mental health, overall health point of view. You can check your blood sugar, fasting blood sugar, your fasting insulin. We're going to talk more about this at the next session with regards to metabolism, the weight concerns of menopause. But these are routine tests that I do. Complete thyroid panel. We want to check your brain's regulation, the actual output of hormone from the gland itself. That's valuable to check for sure if you're feeling really tired and not yourself. Complete blood count is your white blood cells, your red blood cells. We can see if there's anemia based on running that. Ferritin and iron, that's checking iron stores and availability in the body. Vitamin B12, I'll check a lot as well. I find we set the bar really low if you're in Canada for B12 and iron levels on blood work. So a lot of women are told you're fine or it's totally normal. And I look at it, I'm like, nah, that's not very good. That's not helping you feel any better. Vitamin D, I test it a ton, pretty much with everybody. Having really low vitamin D doesn't make you feel any better. It makes you feel tired. Seasonally, often you're low vitamin D in the winter, in the darker months. And when the sun comes out and when we get out in a bit more, it does come up. But anybody that lives in Canada or at the northern latitude we do, I would argue, get your level tested. You might need to supplement to get you to the ideal. Cholesterol panels, that's another good baseline test. CRP is an inflammatory marker. So if I have reason to think there might be more inflammation going on, I'll test that. Aches or pains, joint concerns, things like that. Liver and kidney function tests, PAPs, I'll make mention. Every 3 years at minimum, but sometimes they need to be sooner if there's any history of cervical cancer or regular cells. You keep up until you're 70. That's the general recommendation. But these are a lot of the baseline things that I test a lot of. And as an ND, I can test these things, but doctors can test these things too. So just worth considering. So, you know, I've mentioned, like, I just hope this helps you feel like there's lots of options, right? And there are practitioners out there that want to help you build a plan that will work for you. And while it may seem like it's like just absolutely no fun, like what a design flaw this is, this hormonal transition is a normal part of your life. And I haven't been there yet, so I can't say personally like, oh, I know what the opportunity is in it, right? You can chime in if you want, but it does not have to be synonymous with suffering. I can say that with confidence. It doesn't mean I can make everybody like, oh, absolutely no symptoms or changes whatsoever. And I'm not trying to make women 20 again either, but it does not have to be synonymous with suffering, or that you just have to settle for it. Yeah, so there's so many different things that can be done. I really truly believe that women at midlife are literally holding up the world. I see you're doing a lot, and I believe that your bodies and brains, and you just deserve more support and more communication around how to keep yourself healthy so that you can keep doing all the great things that you are. This is the next workshop. We're going to talk more about heart health, because it's still the #1 cause of death in postmenopausal women. It's not breast cancer, it's heart disease. I want to talk more about that and what we need to know about lowering our risk of heart disease. We're going to talk about the weight gain a little bit more, and we're going to talk about bone health, which might be like the most least exciting, but honestly, like fractures and falls are no joke, and bone health matters. So we're going to talk about that more too. These are some resources. These are the NAMs I'm a member of. You can go to their website. These are books that I've referred lots of women to. And then I have some other things here. Burnout is a great book about stress in women. I loved it. There's a great audio book that you can listen to. Insight Timer has these great sleep meditations. I use that app, but there's lots of other apps. There's like Headspace, Calm, all these different ones. I find listening to something, I used to be someone who wanted to watch something right before bed. Now I listen to something instead. Yoga Nidra is really nice, but there's lots of sort of tools for that too. So just wanted to leave you with some resources. This is being recorded, so you can listen to it again. And my email is right there, bhill@stonetreeclinic.com, if you want to email me with any particular questions. Okay. Okay. Well, are there any other questions for the time being? What are we time at? I went a little more than an hour. Sorry. Okay. Well, that's it from me. Our next, I think the next date is June 7th for the next one. So yeah, I'll look forward to seeing more people there. I can't see you, but I know that you're there. So thanks for coming today.
Thank you so much, Bronwyn, for that fantastic talk. That was so much valuable information, and it is great that it was recorded so we can look back at it.
Yeah.
And we hope to see you on June 7th and register on our website. So thanks very much, everyone. Thanks for joining us.
Thanks, ladies. Bye for now.
Bye.